Hi, my name is Jacob Langston. I'm a DMP anesthesia student in the College of Nursing at the University of Arkansas for Medical Sciences. Welcome to my presentation of my concept analysis of nurse empowerment. In today's rapidly evolving healthcare landscape, understanding nurse empowerment is crucial for improving patient care, job satisfaction, and overall healthcare outcomes. Using Walker and Avant's method of concept analysis, we will explore the essential elements of nurse empowerment, how we apply it in the healthcare setting, and the impact it has on nursing practice, education, and research. By the end of this presentation, I aim to offer a comprehensive framework for implementing and evaluating nurse empowerment strategies in your own practice settings. And we'll start our presentation now. The purpose of this presentation is to apply beginner's and novice to expert theory to the concept of nurse empowerment using Walker and Avant's concept analysis framework. It's a structured approach that involves the 8 listed steps here that examine the concept's attributes, uses, and outcomes. This method helps define nurse empowerment and provides a framework to apply it. By analyzing nurse empowerment this way, nurses and nurse educators can better understand, implement, and evaluate strategies that enhance nurse empowerment in their education, practice, and research. Patricia Benner's novice to expert theory examines the building blocks of professional growth in nursing, which directly contribute to nurse empowerment. As nurses progress through Benner's 5 stages, novice, advanced beginner, competent, proficient, and expert, they not only gain clinical skills, but also the confidence and autonomy in their practice. This evolution empowers nurses to make complex decisions, advocate effectively for their patients, and contribute meaningfully to interdisciplinary teams. The theory's emphasis on learning and the value of practical knowledge validates nurses' lived experiences, encourages them to trust their intuition and clinical judgment. This empowerment is crucial in modern healthcare where nurses often face challenges that require quick, informed decisions. By recognizing and fostering this professional growth, healthcare organizations can cultivate a more skilled, confident, and engaged nursing workforce, ultimately leading to improved patient outcomes and a more resilient healthcare system. It's important that we define what nurse empowerment is and how it's applied outside of the nursing world to better navigate its meaning. Please forgive my pronunciation of some of these names. According to Fawcett, they define nurse empowerment as the individual's perceived sense of meaning and purpose, competence, self-determination, and the impact on the work role. But we need to look at it from other perspectives. Voskinen, Wittkiene consider empowerment from the patient's perspective. In this context, they suggest that patients are empowered through the ability to get what is needed through resource allocation and to influence how others think and feel and believe. It can also be applied in an office setting. Ichibiri et al. Describes empowerment as a working engagement at the emotional level. It flattens the hierarchy and increases employee participation as power is shared. The critical attributes of nurse empowerment encompass several key elements that shape a nurse's experience and effectiveness. These attributes give nurses a sense of purpose, clearly define their roles, and promote autonomy and independence in their decision making. It improves job satisfaction and ultimately it streamlines patient care processes. As Choi and Kim demonstrated in their study on Korean nurses, structural empowerment and shared governance have a direct positive impact on nursing autonomy and job satisfaction. This research highlights the importance of these attributes in creating an empowered nursing workforce. These attributes were selected because they emphasize the ability of healthcare organizations to create an environment where nurses feel valued, confident in their abilities, and are motivated to provide high-quality patient care. This empowerment not only benefits the nurses, but it also contributes to improved patient outcomes and overall healthcare efficiency. First, we will look at a model case of nurse empowerment. This is a personal example. It's an experience of mine that occurred about a year ago. A coworker and a fellow classmate, you all may know Kelsey Kaiser, and I recognized a pattern of a lack of preparedness and understanding of rapid decompensation in post-operative cardiac patients. We brought our concerns up with our supervisors, and their suggestion was to teach a post-operative cardiac care class. We spent several months preparing presentations and handouts and started teaching quarterly classes that covered anatomy, pathophysiology, pharmacology, recognition of decompensation, and how to escalate care effectively. The image on this slide is from the first class we taught. Not only did it provide useful education for our staff that empowered their work, I learned a lot in the process myself. It gave our team the necessary tools to work more effectively and confidently with our CVICU team to take even better care of these critically ill patients. Reflecting on it now, I can recognize that we were implementing concepts of beginner's novice to expert theory to empower our staff. Next, we'll look at a contrary case. This is if we had handled this differently. Oftentimes in these emergent situations, veteran nurses try to educate in the moment while simultaneously juggling the tasks of communicating with different disciplines, managing medications, assessing the patient, and retrieving supplies. Possibly a patient could be coding. Cath lab is calling to prepare a room for a bedside cannulation. Three residents are asking you different questions that aren't related. There's an x-ray tech in the room knocking over your chest tubes, and the novice nurse is panicking while half a dozen other people gather in your room without a defined role. If we continue to try and educate at the bedside, rather than taking the steps to formalize this education to empower our nurses, we set ourselves up for failure. Nurses will not feel empowered because they may recognize the patient's decompensation as their own failure, and they're too stressed to effectively listen and learn. The experienced nurse feels frustrated that they're juggling too much at once. Choi and Kim's findings further emphasize that heavy workloads decrease opportunities for empowerment. To rationalize our model in contrary cases, we need to identify antecedents and consequences of nurse empowerment. For nurse empowerment to be possible, we need two events: access to education or training and supportive leadership. Choi and Kim understood that structural empowerment for shared governance amongst nurses coincided with my model case. When training was given on how to perform professional governance that was mediated by management, their research showed a positive correlation of nurses reporting that they feel empowered. This empowerment brings about our consequences of job satisfaction and improved patient outcomes. Research like Joy Kim's shows that empowering nurses allowed them to voice their opinions regarding improved patient care. Support from management forms an optimal environment for empowerment, and it allows nurses to set goals that they are invested in. Looking back at our modeled case, it meets these antecedents and it had the same consequences. But compared to our contrary goal, we can see where it falls short of the antecedents and therefore it does not receive the same beneficial consequences. Empirical reference are the observable measures that validate the concept of nurse empowerment. We'll first look at an objective measure, increased autonomy. Abu al-Ruz et al. Recognized that work performance is enhanced, and nurses have a higher level of engagement when they are psychologically empowered. Nurses become more involved in clinical decisions, they participate in leadership, and they are better able to implement evidence-based practices. We must also recognize a subjective measure of nurse empowerment, perceived confidence. Echeverry et al. Observed manifestations of empowerment through autonomy, a self-determination to have initiative, and the ability of putting meaning behind one's work. Confident, autonomous nurses have a sense of ownership over their work and over their professional development that helps to support their patient care. Lastly, we'll explore three areas of implications influenced by nurse empowerment that neatly wrap up the concept I've explored thus far. Nurse empowerment fosters effective patient-centered care, contributes to a positive work environment, and encourages nurses to become leaders. Empowered nurses are more inclined to contribute to nurse-led research, which in turn develops evidence-based practices and creates innovations within the nursing practice. Going forward, education programs should continue to prioritize leadership within autonomous practice and focus on cultivating the skills and knowledge necessary to develop independent nurses. These are my references. Thank you for watching and listening to my presentation. I'll include a link to the PowerPoint as well to review it further. Thank you.